institutions. One is a very big, probably the biggest microfinance program, One Health, and another is a small NGO, and it is going beyond health education and linking to health products and health services and also health finance. So I request Dr. Soumitra Datta, who is from Freedom from Hunger, to moderate the session, and it is over to you, Soumitra.
Thanks, DSK. Probably this is the last session before lunch, DSK?
No.
Oh, this is it.
Okay.
It's just to wait for Bob.
I have an announcement to make. We have with us 4 bright students from IIT Gandhinagar, along with their professor, Professor Uttama Lahiri. So Professor Uttama Lahiri is having a lot of work going on in her laboratory to develop innovative healthcare diagnostic methodologies. So they have come prepared to give a demonstration to you. So after this session, we will have 5 minutes presentation by Professor Uttama Lahiri, and then during lunchtime, I request you people to somehow take some time and interact. We may not give you full 1 hour lunch. Supposing whoever is interested to interact with them may go separately there, interact and then come back, so that these 2 things go on simultaneously. We cannot completely stop this or completely stop it. So lunch will be cut short by half an hour. Lunch will be served here only. Let us finish, and you can be in batches, 2 or 3 of you. Whoever wants to interact with them, they go there, interact, and then come back. So that's how we'll continue. So, shall we go? Yeah, the last but one session before lunch.
Thanks, DSK. This session has been reduced by 10 minutes, so I'm going to go very quickly with the presentation, followed by some questions to the 2 panelists here. As you see, this is a specific project of Freedom from Hunger. It's called Ma or Shishu Swast, it's MCH, and this has been partnered primarily by 2 organizations, and I always love to mention, though we have been saying this here this morning quite often, still I would like to mention why Freedom from Hunger integrated health on the platform of microfinance or any kind of financial services. What are the primary reasons for? There were several reasons. I've just chosen some. So we have found that in order to protect the health of the poor, these are some of the common reasons. Almost all the groups who are into financial services, they are disciplined, they're committed, and of course they meet in a group regularly. Since they are interacting with a particular MFI representative or whatever you call an agent or NGO staff, there's a good relationship between the field staff and the group. So there is a trust. We took advantage of that. And also, they have similar socioeconomic status and serving the underserved areas. We have also found that if they are committed in the financial services, if they're committed, it also motivates them to do other activities, including health. Well, Freedom from Hunger was, in India it got established as an Indian entity in 2012. This organization is as old as 1945, US based, but we have a full-fledged Indian entity currently. From 2007 to 2017, we reached, this is a figure that we reached through the women's groups, be it Microfinance Institute or Self-Help Promoting Institute, through 26 partners. So we usually work with partners because we are a technical support agency. And in 12 states. And the model that we used was MAP initially, Microfinance and Health Protection. And as we said that we added health, it was a value addition to the microfinance services. The current project that you see, of course, one which was just being presented, Rajasthan Nutrition Project. We are also working with the Tata Trust and several other organizations in Madhya Pradesh called Transforming Rural India. This is multi-sectoral. So it's not only health, we also have education, livelihood, and other development sectors. And of course, I'm going to talk about mass a bit. This is the discussion point for this particular project here. As I said, we actually worked with 12 partners. But for this particular project, we boiled down to these 2 partners. Well, I've given some reasons why we have taken this. If you look at these 2 partners, they are quite contrast. Bandhan, if you know, it's currently the largest microfinance institute in India in terms of volume and clients. And also, of course, it's a bank now. And they have a good many experience, more than 10 years. And I have the pleasure of working with Bandhan, starting the Bandhan Health Program when I joined Freedom from Hunger 2006. Since then, we are still associating with them. So, for Bandhan, they have their expertise, they have huge geography, which makes the whole model of health integration quite sustainable. And also, you can show, I mean, there are researches already being done to show the impact, not only in the pilot areas, but also at scale. As far as ADS is concerned, Oikotan Development Society, well, it's a health NGO. In fact, it was started as an NGO. It was developed as an NGO by CARE in somewhere in 1999. And they are consolidated, it's a small organization. They're consolidated in one particular district of West Bengal. They have a very strong SHG movement, and they have a very strong relation with the government. The whole sanitation program in 2 blocks of one of the districts is covered by this particular organization. And they have the ability to innovate. We did different kinds of innovations, which we will show, along with, of course, Bandhan. So on one side we have Bandhan, the other side we have ADS, and we have selected these 2 partners for this mass project. Well, this is the intervention. So as you see, Maa Shishu means, of course, the main focus is on pregnant and lactating women, but also we have also included children as part of MCH and the adolescent girls. And the main point here is, in order to improve, you need to increase access to health knowledge and health services. So in order to do that, we took these 3 major components. Again, these 3 major components also came from Microfinance and Health Protection, the MAP project that we started in 2006. So we have health education in order to provide information to the clients. We have, I mean, even if they have information, they may not do anything unless they have access to quality services. So that requires an effective linkage, be it private or public services providers. And we have been talking a lot about health financing. So if you don't have, because whether you go to the public or the private sectors, there is a cost involved for any kind of illnesses. So these were the 3 major components. I'll just quickly go through what we have been doing with the partners. In terms of health education, of course, as D.S.K. Rao and others have mentioned, we have a whole list of modules on various health topics, even non-health topics. But for this particular project, we were engaged in anemia, which we did last year. Currently, we are having some essential components of MCH, which also includes linking with the service providers. And we just started menstrual hygiene for the adolescent girls. Menstrual hygiene for the adolescent girls is started by Bandhan currently. Pictorial and technical learning conversation is just this type of training method that we use. So we use learning conversation, which is participatory, as we all know. Various organizations have different models. And we also use pictorial, specifically in those areas where the community or the facilitated community are semi-literate. So they can actually make use of the pictures and can facilitate. Then of course, the group platforms. So we have always used a regular group meeting. And for all, like anemia, MCH, we did pre and post assessment. So just before the education starts, if there